So this is the pathology module, and specifically we're working on medications today. So as it applies to the FSMTB, as it applies to the MBLEx, you have to know the most common drugs which increase the risk of patient injury. And injury constitutes things like bruising, excessive muscle soreness. It could constitute things like dizziness. All of these things can lead either to discomfort or they can lead to more serious injury. In the case of dizziness, the concern on the MBLEx seems to be that that person could lose their balance and fall, which is definitely a real concern. So the medications that we really need to be aware of are analgesics. That makes up the largest amount of information for the MBLEx, and anti-inflammatories, or NSAIDs, non-steroidal anti-inflammatory drugs. And those two have some overlap. Some types of analgesics, some types of painkillers are also NSAIDs. For example, ibuprofen. And then we also have muscle relaxers, antibiotics, diabetes management drugs, anticoagulants, antidepressants, anxiolytics. I think I have another iteration of the list down here. Yeah. And then blood glucose regulators, those are diabetes drugs. Both anticoagulants and platelet aggregation inhibitors, those are both blood thinners or blood regulators. Any kind of cardiovascular agent, so anything that regulates the heartbeat, or anything that regulates the heartbeat or the blood pressure. So beta blockers, ACE inhibitors, they help the heartbeat, the heart rhythm. Diuretics regulates the blood pressure. Sedatives, skeletal muscle relaxants, meds, any med that causes dizziness or orthostatic hypotension. Let's go over some of the phrases, some of the terminology. So orthostatic, hold on, perhaps I need to make this larger. Orthostatic means the position that you're in. So ortho refers to the positions of the bones. And if you are sitting down, your bones are in one position. If you're standing up, your bones are in a different position. So if you change position, do you get hypotension? Do you get low blood pressure? Someone who changes position, like going from sitting to standing, and feels suddenly dizzy, or even has more severe symptoms like tunnel vision, loss of vision, loss of hearing, disorientation, that's very serious, because if someone gets off your massage table or gets up from the chair in your treatment room and they lose their balance and fall, they could injure themselves severely, and it's a liability for you and for your employer if you're going to work with someone else. So orthostatic hypotension means a change in position that causes low blood pressure, sudden drop in blood pressure. Okay, and then analgesics, this is a word that we're going to see over and over and over again. So analgesia means pain. And a or an means anti or away from. So analgesics are medications that are anti-pain. Antibiotics, bio means life. So antibiotic is a medication that kills everything that's alive, that it touches, literally, anything it touches. That's the bad microbes that are making people sick. And that's the good microbes which help people to stay well. So if you have strep, if you have streptococcus bacteria proliferating somewhere on your skin and your muscle and your gut and your nasal passages, lungs, whatever, antibiotics will start to kill the streptococcus bacteria. But it will also kill all of your other bacteria. I don't know the names of the bacteria, but all your other bacteria that live in your gut, that live, on your skin, in your mouth, nose, and eyes. It'll start to kill those as well. And antibiotics, therefore, means anti-life or against life. Anti-inflammatories. So inflammation, understand that inflammation means specific things. It means a proliferation of swelling, an increase of swelling or a fluid. And with that fluid, with that proliferation of blood and interstitial fluid, often comes higher immune activity. So if you have a sprained ankle, there's inflammation that the body actually creates. It creates it through the platelets. It's the platelets' job to start creating inflammation. And in the inflammation, there is a lot more blood, which brings more white blood cells and more immune mediating cells to the area and more red blood cells. So inflammation serves initially to bring blood to the area. After a certain period of time, over time, it blocks blood flow, but initially it brings fresh blood to the area. It also brings in all the repair molecules, like all the proteins and all the structures, all the nutrients necessary to start rebuilding things, you know, like collagen and tendons, muscle fibers, bones, whatever needs to be repaired. And inflammation also has the effect of distending the area or making the area edemic or swollen. And the swelling itself is a symptom of inflammation. Oftentimes there is warmth or heat because of the inflammation, not always, but sometimes, and because of the increase in metabolic activity. So there can be heat, there can be pain because the distension causes pain. There can be swelling, there can be stiffness and lack of mobility because the swelling acts like a brace. So when you see inflammation, you can think about all those things happening in the context of an injury. You can also think about another context for swelling, or another context for inflammation is widespread internal or in specific organs. And that inflammation can come from a variety of things. It can come from an allergy, which is an overreaction of our own immune system. You know, we eat something or breathe something or contact something with our skin, and our immune system starts to make the area swell. It causes us redness, itchiness, and pain on the skin. It causes us redness, itchiness, and then swelling and congestion in the nasal passages, like I have, and I'm going to have for, you know, I think another 2 weeks. It causes sometimes swelling in organs. Organs can become inflamed. They can become swollen. It also can cause widespread inflammation. There are a few examples of widespread inflammation that happen commonly to us, like when we get colds or flus, or when we get very tired, when we don't rest enough. The body doesn't regulate the inflammation throughout the body well enough. And as we get older, it becomes more visible. You can see it in children too, but as we become older, you can see a more swollen, distended face, a more slightly swollen body when people get a cold or a flu, or when they're very tired. Inflammation also can happen in the context of an autoimmune disease. And an autoimmune disease, like, for example, rheumatoid arthritis or lupus, which are two common ones that I see on MBLEx questions, those come with both local inflammation and to a lesser degree, systemic inflammation. So with lupus erythematosus is known for redness in a kind of a butterfly shape across the nose and under the eyes. So lupus is an autoimmune disease that causes that kind of pain and swelling, but also pretty severe fatigue. And people can also have like widespread joint or muscle aches. They just feel achy all over, like they have the flu. And then rheumatoid arthritis, the most severe inflammation would affect the joints where the rheumatism is manifesting. Always bilateral, doesn't look the same on each hand, but there's always deformation on each hand, deformation on each foot, and it may be to less or more degree, but it's always bilateral in the limbs, and that's just kind of a piece of information, you know, so you can look at the client and look for inflammation or look for where the rheumatism is affecting them. But the inflammation on one side may not be visible to you, and they may not be perceiving pain. I have seen patients like that, where they have more severe inflammation in one elbow than the other, or in one thumb than the other. So inflammation can look like several different things, right? It can look like that acute injury. It can look like overreaction of the immune system. It can look like an autoimmune disease, which also is overreaction of the immune system. So maybe I should be saying from external factors like allergens in the air or in the food or that we come in contact with, as well as internally generated overreaction of the immune system. And it can look like visible swelling throughout the body or localized swelling without an acute injury in the case of rheumatoid arthritis or cold or flu or being excessively tired. So NSAIDs, non-steroidal anti-inflammatory drugs, are one of the options that Western medicine prescribes for inflammation. So whether that's a sprained ankle or something more widespread, something more systemic or general. Remember, systemic refers to body system. The skin is a body system, the respiratory system is a system, etc. Or general, meaning the person is just generally in larger areas inflamed. Anti-inflammatory drugs are one option, and then steroids are another option. You don't need to know why they may give steroids compared to NSAIDs, but in my experience, people are more likely to be on NSAIDs for things that are not really severe, and then they go to steroids for things that are really severe or really acute. So if someone has an allergic reaction that's causing their respiratory tract somewhere to swell and close up, that's life-threatening, right? Because soon they may not be able to breathe. So they would definitely give them steroids for that instead of NSAIDs. NSAIDs can be over-the-counter. There are many over-the-counter NSAIDs. They're also bundled with analgesics. So ibuprofen is one. I think other drugs such as Aleve may be NSAIDs, but you can tell just by looking at the package. And then some things like aspirin. Aspirin is only an analgesic. I think it also has a beta blocking component. But we'll look at aspirin a little more specifically later. Where we have to bring up specific names of drugs like NSAIDs, steroids, insulin, ACE inhibitors, diuretics, we do that in the lecture, in the slide, and in the questions. If there are drugs that we don't bring up the general name, the generic name, or the brand name, like for sedatives, for example, just know that's okay. You can go look those up if you want to, if you're curious, but I believe that what I have presented here in this medications lecture plus AMTA questions slides is what you need, is sufficient for what you need for this aspect of the pathology module. Just so you're aware, if you look at the statistics on prescription drug use in the United States over age and what people use, you see that when we start life, there's not that much prescription drug use, right? But when there is, it's for severe stuff like infections or for asthma. And then there's some for attention deficit disorder. That's for 0 to 11 years. And then in the teen years, the attention deficit disorder drugs, the central nervous system stimulants like Adderall, central nervous system stimulants take over, they take the lead. There's almost twice as much CNS stimulants for teenagers as there are asthma and other medications. And then of course, in the teen years, women begin to menstruate. People who can menstruate start to menstruate, and they sometimes take oral contraceptives. And then in the 20s up into about 59 years of age, people start to develop systemic and metabolic problems like high cholesterol, depression, and chronic pain, or excuse me, chronic pain. And so they have to take things like antidepressants, cholesterol over lipid lowering drugs, and then analgesics. Okay, guys, I feel a sneezing fit coming on, so I'll be back in less than 60 seconds. I'm just going to pause the recording and leave everything else the way it is. All right, and then over 60, we have diabetes appearing to be more severe. You can have diabetes at any age, but we have diabetes appearing to be more severe and more adult onset diabetes. heart diseases like high blood pressure or heart attacks, stroke, we see those starting to become more severe, and cholesterol, high cholesterol just continues. This is our culture, guys. We need to think about this. Like there's at least 3, maybe 4 different main ways of eating in America, and the origins of those, they're sometimes nefarious. They sometimes come out of poverty, and as a result of people just doing what they have to do, they consume whatever's around, which sometimes includes things that raise our cholesterol, that spike our blood sugar, or that over time can exacerbate things like chronic pain. So this is really something that we need to think about, particularly us, because we work on our feet all the time, and we use our bodies to do our work. I'm an acupuncturist. I also do some massage. We call it body work, or tuena, or ama, or shiatsu. But anyway, I'm in the same boat as you guys. I use my body to help other people, and I could not imagine having blood sugar fluctuations that I couldn't deal with, or low energy from a cardiovascular history that challenges me to the point where my work is impaired. So that is definitely something that we all should think about. So we're going to start with analgesics, because analgesics make up the largest, in my opinion, analgesics make up a large percentage of the questions in the patho module. So, and analgesics, I think, are probably the most widespread over-the-counter medication. They can be prescribed like opioids, or they can be over-the-counter. I just want to mention that the opioid analgesics, the opioid pain medications that we all have heard of, fentanyl started as an opioid pain medication, and then oxycodone, and then synthetic oxycodone and synthetic Tylenol. Those are all analgesics, and we've all heard of those because of the high rate of addiction and the high rate of death that occur with those. So if someone comes to your clinic, or if there's a question on the MBLEx that says this person was prescribed oxytocin by their doctor for back pain, you need to take that question with more gravity than someone who is prescribed like Tylenol alone, or who's taking Aleve or ibuprofen for their back pain. So analgesics, we're going to go over some of the non-opioids first. So basically, non-opioid, especially over-the-counter analgesics that you can just go and pick up anywhere, are classified as miscellaneous analgesics. They don't relieve pain in a specific area, and they have different mechanisms across different brands or different applications. Aleve works a little bit different from ibuprofen. Ibuprofen works a little bit different from Tylenol. Tylenol works a little bit different from aspirin. It's not even really well understood what the mechanisms are, but they think it has something to do with maybe blocking an enzyme in the brain. In the case of acetaminophen, they just know that it works, and it also has these other effects, like in addition to relieving pain, it also reduces fever. It's used so widely. That it's not just taken on its own as an analgesic. It's also combined with other medications for other symptoms like colds and flus or allergies, in order to help people to feel better, because the manufacturers and the medical professionals who they consult, they know that with cough syrup, for example, with Robitussin cough syrup, or Mucinex, which is for the production of phlegm, to reduce the production of phlegm in the lungs, they know that people often are coughing and are uncomfortable. It can be very painful throughout the rib cage and the intercostal muscles and the throat, etc., to be coughing all the time. Pain also accompanies indigestion, like for Alka-Seltzer Plus. There's ibuprofen or other kinds of analgesics in all these medicines, including Alka-Seltzer Plus. It's certainly in something like Excedrin, which is taken for migraine headaches. I don't know why that would be unclear. That's that's Excedrin contains analgesics. I would think that that'd be intuitive. Dayquil and NyQuil, also Tylenol has a few things like Dayquil and NyQuil. They call it like Tylenol cold and flu, Tylenol sinus, and all those products may be taken for things like sinuses or cold symptoms or inability to sleep due to discomfort from cold and flu. But they also have, you know, acetaminophen in them. So you have acetaminophen, and let me just get you a definition. Acetaminophen. Okay, acetaminophen. Some of the brand names include Tylenol, Feverol. Acetaminophen is kind of a brand name, and then there is ibuprofen, and I wanted to separate those out because the effects of ibuprofen and acetaminophen are a little bit different, and I want you guys to be aware that some people can be allergic to acetaminophen, and the allergy can be life-threatening. And unfortunately, there's no test for acetaminophen allergy. But if you give someone Tylenol, which is acetaminophen, if you give someone Tylenol and they have an allergy, and they don't know that they have an allergy, they could start to have liver failure. And in the rare case that does happen, either the child dies or the child gets to a hospital in a hurry. Like sometimes emergency response will be quite high. Like they airlifted a kid from Manhattan. A colleague of mine had a kid who took Tylenol, and they found out that he had an allergy that way, and they took him in a helicopter to like someplace in Westchester, hospital in Westchester. It was known for dealing with that kind of thing. It's scary, right? And then ibuprofen is often taken for pain, but it is an NSAID. So it says it can treat fever and mild to severe pain. So oftentimes you will see pain medications like Advil, ibuprofen, children's ibuprofen. What else here is familiar? Motrin. All these are ibuprofen, not acetaminophen. And ibuprofen, while it is used as an analgesic, it's classified because its main action is as an NSAID, a non-steroidal anti-inflammatory drug. And so you have to be aware that if someone says I'm on an NSAID, that they may also have their pain sensations, their sensory capacity to perceive pain may be significantly lower than if they were not on an NSAID, right? And so, you know, that affects how much pressure you apply to someone. It affects your approach, you know, how you design a treatment for someone. And it also should affect how you evaluate them. Someone who can't feel very much pain, if they come back and they say everything's the same, well, that doesn't mean that you need to change your tactics or that you didn't help the person get better. All it means in the case of someone taking NSAIDs and analgesics is that they're not feeling the same amount. They're feeling the same amount of pain week to week, right? Their perception of pain is different, and that may be why. Guys, I'm sorry that I'm having to revise my sentences, go back and restate things. But like I said earlier, life is throwing me kind of some challenges right now. And so I'm not as clear, not as sharp as I want to be.
Okay, I just had a question.
Yes.
When you was talking about the different medication, like the acetamin.
Yeah.
Okay.
Acetaminophen. Yes.
I had a reaction to Aleve.
Yes.
And the other brands that you were saying under the ibuprofen, they was telling me I can't take none of those. Only to take Tylenol.
Yes. So yes. So Tylenol is what kind of medication? I just want to see if you remember. Is Tylenol acetaminophen or is it ibuprofen?
Okay, so it has acetaminophen in it. Some of the Tylenol.
All Tylenol. Tylenol has acetaminophen.
Okay.
Yeah, but they told you had a reaction to acetaminophen.
I had reaction to Aleve. So Aleve.
Yes.
And they told me not to take ibuprofen, Motrin, Advil, all those others.
Yes. So Aleve Aleve is different from ibuprofen, but it's a non-steroidal anti-inflammatory drug. So is ibuprofen, but it is naproxen. So sometimes people who have an ibuprofen allergy, or people who can't tolerate ibuprofen, sometimes specific drugs are very rough on different parts of the body, like the stomach, for example. So if someone takes Aleve over a long enough period of time, they may develop stomach pain. And then switching to something like switching from ibuprofen to naproxen, so a different kind of NSAID, may get them the same relief without the side effects, without the stomach irritation or whatever side effects they're having.
So a Tylenol based sort of like a steroidal type of medication.
Thank you for asking. Tylenol is not a non-steroidal anti-inflammatory drug. Tylenol is an analgesic. Aleve and ibuprofen are both non-steroidal anti-inflammatory drugs. So ibuprofen is an ingredient found in Advil and Motrin, and naproxen is the ingredient found in Aleve. Would you guys like me to write this down on the slide for you?
Yes.
Okay. Okay. I don't think they're going to ask you specifically the brand names and everything, but it'll at least help you to keep it clear. So I'm happy to do that. So just hang in there with me one moment, and I'm going to duplicate this slide. Okay, and we're going to look at let me make sure I'm spelling it correctly. Acetaminophen. Acetaminophen. And we're going to do it like this. We're going to do the ingredient, and then we're going to do brand, and then the type of drug. Okay, so the ingredient being, we'll call it the drug instead of ingredient. So the drug acetaminophen is an analgesic. And the brand we usually see is Tylenol. Although you can get plenty of acetaminophen in over-the-counter drugs. Okay, so let's see. So brands that include acetaminophen: NyQuil, Dayquil, Alka-Seltzer, Mucinex, Robitussin. So I'll just put NyQuil because those are really common. Okay, NyQuil. And here's a word that I want you to know, and that word is, hold on a second. That word is et al. So when you see et al., which you may see on some, if you ever read medical reports, or if you read the interactions or the side effects of drugs, they may say, for example, this drug may cause headache, dizziness, drowsiness, et al., or etc. Et al. And etc. are the same thing. All right, so Tylenol, NyQuil, et al. Means others. You know what? Maybe I'll just put others plus others. Okay. All right, and then ibuprofen is an NSAID, non-steroidal anti-inflammatory drug. And ibuprofen is found in Advil, Motrin, and what other brands? I think that's probably enough, but Advil, wow, the US brand names are like Genpril, Haltron. I've never heard of these. Okay, so those are Advil, and what's the other one? Testing your recall. Motrin. Motrin. And we have this idea in our culture that we take like that we take Motrin for one thing and Advil for another thing, but they're both ibuprofen. And then there's naproxen, which is also an NSAID, and that's found in Aleve. I will add, in addition to acetaminophen, I'll also add salicylates or salicylic acid, and that also is an analgesic, and that is aspirin, and we know that as Bayer. So salicylic acid, salicylates, a type of drug found in over-the-counter medications. Aspirin is the most common type of salicylate. Bayer, Ecotrin, aspirin, and other salicylates are used to reduce pain, fever, and inflammation. They also have a mechanism for blood clotting. And okay, salicylates also reduce platelet clumping. Okay, so salicylates are an analgesic and anticoagulant. Let's see, how am I going to fit that? So what you will see with people who are taking salicylates or what you'll see with people who are taking aspirin is that sometimes they take it for pain, and sometimes they just take it for because they have a cardiac history and they want to prevent that. Okay, so let me just clean this up a little bit so you guys can actually see it. Yeah, analgesic. It's also an analgesic plus an anticoagulant. And then, okay, good. I hope this is readable, guys. So acetaminophen is Tylenol, which is an analgesic. Salicylates are also analgesics, but they have the added effect of being anticoagulants, and that's Bayer or aspirin. Bayer is the brand, aspirin is the common name. Ibuprofen and naproxen, those are both NSAIDs. Ibuprofen is found in tons of medications, including Motrin and Advil. Naproxen is found in Aleve. Okay. Any questions about that?
Thank you.
You're welcome. I hope it helps you to organize things. Okay, so where should we go now? Okay, so one of the issues that they may or may not bring up on the MBLEx is that because medications like acetaminophen and ibuprofen are so widespread, they're in more than one product out there, and they can be prescribed as well. Sometimes people take multiple medications because they think they need them, and that can create the danger of toxicity or overdose. So an individual may take Tylenol or Excedrin for the headache of the flu, and they may take Dayquil for the stuffy nose, the sore throat, etc. of the flu, right? Or they may do that with, like, you know, an upset stomach from food poisoning, and they may also take something like NyQuil to help them to sleep if they're suffering from food poisoning. You know, so you can see how, like, you know, people may not know that something like Alka-Seltzer or Dayquil, NyQuil, or Mucinex, which they think treats specific symptoms, also contains analgesics. So you will sometimes see people piling on 2 or more medications that contain acetaminophen. It's a good idea. You just take out your phone and just type in the brand name and see of what they're taking, or type in the medication they're taking and see if they're doubling up on pain relievers, and just tell them, look, go talk to your doctor, call your doctor or call your health insurance and see if you can talk to a nurse through your health insurance today. Let them know that you're taking both of these medications because they contain the same analgesic, the same pain reliever, and that can lead to overdose or toxicity. You know, you're not giving them medical advice, you're referring them to their primary care physician. That's what you're supposed to do. Okay, if there are allergies, as I said before, it can be life-threatening. There's no way to test for that. For massage is not contraindicated for any of the analgesics. You can do massage on anybody who's taking any of these analgesics and on people who are taking NSAIDs, but they have lower pain sensitivity. And because they have lower pain sensitivity, you should plan to use less pressure than normal. And that is a question that you'll see on the MBLEx prep questions later is, how do you deal with someone who has lowered pain sensitivity? The next slide is breaking down the analgesics and NSAIDs by brand and by drug name, drug type. And now we're going to move on to platelet aggregation inhibitors. There's two types of anticoagulants or blood thinners, blood regulators. One is a platelet aggregation inhibitor. That's also salicylic acid or aspirin. I believe that is warfarin or Coumadin. And the other is an anticoagulant. And we'll talk about that. I don't remember off the top of my head what name that is, but we'll talk about that soon. So first we're going to talk about platelet aggregation inhibitors. So the main mechanism is that it prevents the formation of platelets or the clumping of platelets, which is different from preventing clotting. Okay, Coumadin and warfarin prevent clotting. Coumadin and warfarin prevent clotting. Aspirin is a platelet aggregation inhibitor. So Coumadin and warfarin are anticoagulants. Aspirin is a platelet aggregation inhibitor. There must be other types of platelet aggregation inhibitors. Let's see. So aspirin is a salicylate. I don't believe that it's the only one. Platelet aggregation inhibitors. Yeah, aspirin is the most commonly used. Thromboxane, prostacyclin. And these are not drugs that you need to be aware of. I just want you to know that there's more than one out there, but the most common is aspirin. Aspirin is also used for pain and fever as well as inflammation, right? So you may see aspirin in cases of athletic injury or chronic pain. You'll see it when people are taking colds, when people have colds or flus or fevers. Inflammation. Can you guys unmute and name me two cases where you'd see inflammation other than an athletic injury? Can you name me two cases where you'd see inflammation?
In an infection.
One more time.
Like if you have an infection, it may swell up.
With an infection, definitely with an infection, you're going to have inflammation. Yes.
A sprain.
A sprain, yeah. And how about an autoimmune condition? Can you name me one of those?
Lupus.
What about MS?
Multiple sclerosis?
Yeah, would that be one?
I don't know if multiple sclerosis would call for some kind of inflammation mediating drug. But the common ones that you see on the MBLEx are rheumatoid arthritis as an inflammatory disease and lupus. But let me look up, because you will see multiple sclerosis on the exam. So let's look up a little bit about MS. So MS is it's a progressive disease, meaning it gets worse as time goes on. The immune system starts to break down the covering of the nerves, or eats away the covering of the nerves. That's called myelin. The role of myelin is to help nerve transmission to be faster. So with less myelin, nerve transmission becomes slower. And that looks like vision loss, pain, fatigue, impaired coordination, right? So the inability, like poor coordination and balance. And let's see, treatment can help, but the condition cannot be cured. Multiple sclerosis and inflammation. Look at that. Good call. Multiple sclerosis is a chronic inflammatory disease of unknown etiology. Etiology means origin, unknown origin, that involves an immune-mediated attack on the central nervous system. So immune-mediated means immune cells, immune factors, immune system is initiating the attack. And let's see, multiple sclerosis and NSAIDs. Let's see if it's treated with NSAIDs. Okay, so over-the-counter pain relievers like Aleve, which is naproxen, and Advil, which is ibuprofen, can treat musculoskeletal pain and headaches common with multiple sclerosis. These medications lower pain and lower inflammation in the body, which can also help the pain associated with MS. So when would someone with MS, like other autoimmune diseases, when would someone with MS take naproxen or ibuprofen? Would they take it on a daily basis, or would they take it when symptoms start to become more severe?
When they
Become
start
more
to become
severe.
more severe.
Yeah, more
Yeah.
severe.
Yeah, and why would they try not to take these NSAIDs on a daily basis?
Become addictive. Could they become addictive, or they become less?
Well, these specific NSAIDs are not addictive.
Okay.
I think you're thinking about over-the-counter, like opioid-based analgesics like oxytocin and fentanyl, but they can have pretty severe side effects over time, right? So the stomach pain from taking ibuprofen on a regular basis, for example, skin breakouts, it can worsen swelling, it can worsen pain over time. And then also when you stop these medications, if you take them for several days, when you stop these medications, there's always a rebound. There's always an increase in the symptoms, whether that's headache or musculoskeletal pain. There's always a flare-up when you first stop them. So yeah, they're not appropriate to take long-term. They're just, they're just for the more severe moments. Okay, so used for pain, platelet aggregation inhibitors. We're talking about aspirin, which is a salicylate, pain, fever, inflammation. Also the maintenance and prevention of clotting related problems like stroke, myocardial infarction. Myocardial infarction means heart attack. Angina, which means the starving of blood, the starving of oxygen from the heart getting insufficient oxygen in blood. If someone is taking aspirin, they bruise more easily. So you have to avoid deep tissue massage, and they may specify such strokes as deep kneading, muscle stripping, and trigger point compressions. I've seen that on some of the practice questions, like a client is taking aspirin or taking warfarin or Coumadin, which are different medications, but they're medications that prevent clotting. And you're supposed to know warfarin, Coumadin, and aspirin, they make someone susceptible to more severe bruising. And the question is, so which techniques are not appropriate for this client? And they'll say, deep tissue, trigger point compression, and they may throw one in that's like Tapotement, and you're supposed to pick that out of the multiple choices. Instead, you can use gentle compression, you can use friction, you can use petrissage. And if you click on this link here, it'll take you to the article by the AMTA that talks about that. It's a good article. You should check it out. From the same article, if we organize medications by disease type, so we have been organizing them by drug, but if we organize them by disease type, and we talk about arthritis, diabetes, Parkinson's disease, it's also very useful. It clarifies things. So arthritis, the main drug given for that is acetaminophen, also tramadol, and sometimes narcotics, right? So that would be opioid-based drugs. Illegal narcotics include cocaine, by the way, and those are primarily for pain. And then NSAIDs are for both pain and for inflammation. And those include ibuprofen, whose brand name is what? Ibuprofen's brand name is which one? Aleve or
No,
uh,
Advil,
Advil?
Advil and
Yes, yes, and then also naproxen's brand name is what?
aspirin,
Aleve.
Aleve. That's right. Yes. They sometimes will give corticosteroids, which are like the heavier hitters. That's like a one up from NSAIDs, stronger than NSAIDs. Prednisone, cortisone, those steroids or corticosteroids, same thing. Oftentimes they'll give them orally, so it's affecting the entire system. Sometimes they give these special drugs called disease-modifying anti-rheumatic drugs, DMARDs, or they give biologics like, I don't even know what these are actually. I haven't seen those on an MBLEx test prep. The reason I included those was because it's on the AMTA. It's because it's on this from this AMTA article. Manage and treat autoimmune conditions, and what is a TNF blocker class of medication? I wouldn't focus on this last line. Just look at it once or twice and so that you're aware of it, right? So people who take pain relievers, we've been saying this over the other slides. People who take pain relievers, they don't perceive pain the same way. They have altered pain perception, but they also can have low blood pressure. They also can have dizziness, and they can have enhanced bruising, more susceptible to bruising, more susceptible to bleeding. And so you have to think about what techniques might cause bleeding or what techniques might cause bruising. You guys may not be causing much bleeding, but I work with needles and lancets, and that sometimes does cause bleeding. However, if you have someone with a local contraindication where the skin is open, you definitely want to be extra aware not to work on that area, because if you open that wound, whether it's a cut or a sore or whatever, the bleeding will take a longer time for that person to clot, a longer time for that person to stop. Corticosteroids, people who suffer from arthritis, who may be taking corticosteroids. Corticosteroids have pretty severe symptoms sometimes. So people's legs can swell up. So the fluid return, venous return, and the lymphatic return is impaired. They can lead to thinning of the skin. This is over long-term use of corticosteroids. Swelling of the legs, thinning of the skin, and then the tendency to bruise. That's because all the membranes of the blood vessels and the lymph and the skin, all those start to break down. It also can lead to high blood pressure and to weakened immune response. The reason it leads to weakened immune response is because steroids or corticosteroids, which include prednisone and cortisone as things you take, and cortisol as what our body generates, what our adrenals generate, they reduce our immune system's ability to function. So if you have prednisone or cortisol, or if you're producing cortisone, like you have high amounts of stress, and you're producing cortisone, one effect of that can be that your body doesn't respond to an infection as well. So infections can proliferate more easily, or some minor infections like a cold, you may not even notice. So you may be carrying rhinovirus or other types of viruses that cause cold symptoms, and you may not have any of the symptoms because your immune system is not generating swelling and runny nose and sneezing and irritation of the tissues. One common mechanism that may help you remember that steroids reduce immune response is getting sick on vacation. People go on vacation for 5 days. They start to relax. They're away from work, away from stress. And as they relax, their cortisol levels start to fall. Their adrenals no longer produce as much cortisol, and then their immune system activity starts to increase. So about the 3rd, 4th day, surprise, they get sick. And it kind of sucks to go on vacation and get sick, but it is at the time what your body needs. So maybe that'll help you remember the relationship between steroids and the immune response. Also osteoporosis, which increases the risk of bone fractures. So you can see like if someone has long-term steroid use, you definitely don't want to be putting pressure across the bones, putting pressure on the bones in the same way that you would someone who is not on steroids long-term. If they have a weakened immune response, you want to be really careful to make sure that every nook and cranny of your face cradle is disinfected and sanitized, that the whole place, the table, the sheets, the face cradle cover, your hands, your uniform, everything has been changed, disinfected, sanitized, or is fresh. Try to put these people, maybe try to put these people in a separate room if you have multiple rooms, so that there's time for you or for your staff to go back and clean up the last room that was used. Maybe try to put them at the beginning of the day or take a break before they come in. It is our responsibility to take care of these people. And if they get sick, if someone with an autoimmune disease like rheumatoid arthritis, if they get sick or exposed to something like COVID or the flu, it can be very, very serious. People die from the flu. We don't want to be responsible for that. So also, anything on someone's skin that's transmissible, anything that you bring in that's transmissible, anything in the air that's aerosolized, also can affect people with weakened immune responses. People who are taking corticosteroids or who have elevated cortisol, they affect them more strongly than other people. It's a much more serious risk. And even if that's not something that you have to manage in a clinical context, you do have to know it for the MBLEx, right? So they may ask you, like, what do you have to make sure you do with someone who has an autoimmune disease or with someone who's taking high amounts of steroids? And one of the choices may be make sure that everything is turned over and cleaned and sanitized before they come in. They also may ask you if someone has like low blood pressure and dizziness. They may say, what do you need to do for this client? And one of the choices is often stay in the room and watch the person while they get off the massage table and get over to the chair safely. Just like for bleeding and bruising, they're going to ask you if someone's taking corticosteroids long term, or if they're taking NSAIDs, or they're taking analgesics. How do you alter the amount of pressure? What kind of techniques, such as trigger point compressions, what kind of techniques do you not use, right? Also, sometimes with corticosteroids, sometimes they're taken by injection. They can be taken orally or they can be injected. And if there has been an injection, if there has been an injection, please avoid the injection site. That's a local contraindication, piercing of the skin, an invasive event across the skin. Same for insulin. And if the insulin is injected, you definitely want to avoid the injection site during the massage. That's a local contraindication. Also, just to reiterate, avoid deep tissue work and use more gentle strokes. Any questions about arthritis? There's a lot of information here. We looked at 5 classes of drugs, 3 of which I definitely want you to know. Acetaminophen, tramadol, and narcotics, those are analgesics. NSAIDs, which are ibuprofen and naproxen, and then steroids, corticosteroids, prednisone and cortisone. Cortisone is produced internally, and then prednisone is, I think that's just the brand name for manufactured cortisone. Any questions about any of that?
It's not so much of a question.
Okay.
But with the client that has the corticosteroids, if you decide to have like a separate room for them, could you have something that will cleanse the air of the room, like a humidifier or anything like that?
Well, if you want to clean the air, I think that the 2 most effective are time, which is, and you will see this on some of the practice questions, that a massage treatment room has to have adequate ventilation, right? So you have to have air moving in the room, and you have to give it time. but as far as like what kind of devices you can use, I don't think that they're going to ask you that. But, you know, obviously like a HEPA filter would be a good start. I don't know that a humidifier would add any value to reducing the microbes that are in the air,
Okay,
but you definitely need to circulate the air. And the thinking is that, like, if you have, you know, three treatment areas in an office, that as the droplets, as the microbes start to circulate throughout the entire office, that the concentration becomes low enough that no one can pick up enough of it no one can accumulate enough of it to become sick, to develop symptoms.
okay,
So mainly it's time and air circulation as
okay,
it relates to the MBLEx.
okay.
Yeah. Okay, and then diabetes. So we're going to move on. Actually, we've been working for about an hour or 60 or 70 minutes. So let's take a break. Come back at 12:20 Eastern time. All right. So we left off with diabetes. And or I'm sorry, we finished arthritis, and now we're going to continue with diabetes. So diabetes, the main mechanism, the disease mechanism of diabetes is a lack of insulin in the body, and that can happen. Insulin is produced by the pancreas, and that can happen in one of two ways. The first mechanism is genetic, where the cells of the pancreas simply do not produce insulin. And the result of that is that when someone eats, their body breaks the food down and absorbs the food, and part of what they absorb is sugar. They break it down into sugar. And then the sugar circulating throughout the blood, the amount rises. And with the higher blood sugar, there can come some serious, sometimes life-threatening effects. I don't understand them all, but elevated sugar in the blood can have dangerous implications for the kidneys, the vasculature, the heart, even the brain over time. So our body needs to lower the amount of sugar in the blood, and it does that by having the pancreas produce insulin. Just to remind you of the role of the hypothalamus and the pituitary gland in this, what happens is the hypothalamus, which is like the main sensory unit or the command center of the brain, senses that there is elevated cortisol, that there's elevated blood sugar, and it sends a message to the anterior pituitary gland to produce I forget the name of the, I'm sorry. It sends a message through the anterior pituitary gland with some hormone that I'll look up for you at another time, to stimulate the pancreas to produce insulin, and that lowers the blood sugar. Okay, and then the other mechanism by which people can be challenged to produce insulin is they develop insufficiency of insulin production. That's called type 2 or adult onset diabetes. So with adult onset, it's through the frequent prolonged exposure to carbohydrates or to sugar in amounts that are difficult for us to handle, that basically our pancreas becomes overworked. And over time, it loses its ability to produce insulin in the quantities that we need it. So we start to develop high blood sugar after we eat, and then we experience low blood sugar or crashes after the sugar breaks down. And the sugar also is affecting our bodies in a way that is very dangerous. So some of the things that you see with people who have diabetes over time are cardiovascular diseases, higher blood pressure. You see sometimes edema, like swelling of the legs in particular. Over time, the skin can break down, and they can have things like dizziness and orthostatic hypotension. So the main drugs which are used to treat diabetes are insulin, metformin, thiazolidine, these drugs, which goes under the brand name Avandia. I don't think that you need to know metformin or thiazolidinones or Avandia, but you definitely need to know insulin. But if you hear the name metformin or thiazos or Avandia on the test, you know that the drug that those are treating is diabetes. So what you really need to understand is diabetes, the two different types of diabetes, how it affects the body, and how you as a massage therapist need to treat that person differently, right? But insulin is definitely, questions about insulin and when you schedule a client relative to their availability of insulin, that's definitely fair game for the test. It's definitely something that I've seen in practice questions from the AMTA and from the FSMTB. So some of the diabetes medications, they can have pretty severe side effects, and the ones that you need to know about basically are dizziness and edema, right? So edema affects you as a massage therapist, or is something that you have to look out for during a massage, because there's swelling in a limb. So, you know, you may not, you might be trying to increase lymphatic movement or venous return in a limb, and over time you may be wondering, you know, why am I not seeing the swelling in the leg go down? Well, the reason is because they have edema that's being caused by the diabetes mitigating drugs that they're taking. Also dizziness, you know, we know why dizziness is important for us, because when we have people on massage tables, eventually they have to get up, and that's a really, really serious risk. I did have a friend, an acupuncturist, who had a client get off a table, and you know, she uses like cotton sheets rather than table paper, and which is what I use, and he somehow got himself wrapped up in the sheet, and he tripped and he fell flat on his face, and he you know, basically tried to get even with her, you know, even though she had no malicious intent. He did everything that he could to be really to exact retribution. And you know, when things like that happen to you, you have to weather the storm. But wouldn't it be nice to avoid that? You know, just watch the person get up, spot them. I've had at least one person, maybe two, pass out during acupuncture sessions while they're getting off the table, and thank God I was there to catch them. Okay, so recommendations: if someone is on diabetes, recommendations: get a physician's referral. That definitely will be a question. That question is definitely fair game for the MBLEx. Start with shorter massage sessions to see how the massage is going to affect your client. So instead of starting with a 90-minute massage, start with 45 minutes and then work your way up by 15-minute increments up to the duration that you and your client want. When scheduling massages, do so during the peak availability of the medication. Make sure your client has eaten prior to the session. So peak availability, what that means is simply ask them, will you have your insulin with you that day? Will you have taken your insulin as usual that day? And if they say, well, actually the massage is at 5 p.m. and then at 7 p.m. I'm going to head over to the drugstore to pick up my insulin, then just say, okay, let's have the massage the day before that when you still have adequate insulin, or the day after, not on a day when you still have yet to take your dose, or you have to go get it for the next day or whatever. You know, and if they say no, I'll be okay. Remember, just go by the recommendations made in your profession, and you can simply tell them, you know, this is standard practice. We just want to do so during peak availability of your insulin when you have it and we know that you've taken it. So, you know, there's no harm in moving, and I apologize for the inconvenience. Make sure your client has eaten prior to the session. So a great thing to tell people is don't skip any meals that day. Make sure that you eat breakfast, make sure that you eat lunch, depending on what time your massage is. And it's a great idea to have a high protein snack before you come in. So if they want to have like a very small meal when they come in, or if they want to have, you know, some kind of yogurt or cheese or nuts or nut butters or something like that, depending on what they tolerate, depending on their diet, that certainly would be fair game. Okay, and while you're working on people, while you're working on a client who has diabetes, before you start working on them, inspect visually, look for wounds, look for open skin. It does happen over time with diabetes. Also ask them if they're having any kind of sensory loss. Do you feel everything in your hands and your feet normally, or is it sometimes a little numb, or do you have loss of sensation there? Do you have any changes in what you feel? Do you sometimes get like tingling or numbness or zinging sensations or anything of that nature? Any cramps? How about fatigue or muscle weakness? Ask them if they're experiencing any of those. Those aren't things that you should expect to change by a large degree. You definitely will lower things like leg cramps, tingling, and numbness. You definitely will reduce those temporarily, a small amount. But unfortunately, because of the etiology, we're not able to completely eliminate numbness and tingling or loss of sensation, which is something that you see in neuropathy. Pathy, like pathology, means disease, and neuro means nerve. So disease, so nerve sensations as a result of a disease state, as a result of diabetes, are neuropathy. Any questions about diabetes medications, how we treat someone who's on diabetes medications? We have one more diabetes slide to go, but any questions so far?
No.
Okay, good. So when someone's blood sugar crashes, right, they eat and their blood sugar spikes, and then either their exogenous insulin that they take or their endogenous insulin that they produce, it lowers the blood sugar, which I forgot to mention, it lowers blood sugar by taking the sugar out of the blood and storing it in the muscles, the liver, mainly the muscles, and mainly the liver and the muscles. And when glucose is stored, it's stored in a different form. It's converted to glycogen. And when glycogen is broken down to be released into the blood, it's released as glucose. So it's glucose in the blood, glycogen in the liver and muscles. Glycogen is the stored form of glucose. Glucose is the circulating form of sugar. Glucose, glycogen, glycemia, these all refer to sugar. So hypo means below or insufficient sugar, circulating sugar. So hypoglycemia, also known as insulin shock, is what people with diabetes experience when their blood sugar falls. And it's when it falls very quickly. Hypoglycemia is extremely serious, not because there's such a high rate of people dying from it specifically, but because they can die from what happens to them, or they can sustain serious injury. So what happens when you become hypoglycemic? Well, sometimes you pass out, or you lose your vision, or other senses like hearing becomes duller. You certainly have brain fog, a slower response, and you basically are losing control of your body. So, if you're driving a car or on a bicycle, or if you are, performing a massage, standing over someone performing a massage, and you suddenly experience hypoglycemia. If you go hypoglycemic all of a sudden, you need to eat. You need to sit down so that you don't fall, or lay down in some cases, and then eat something as soon as you can. So it's very serious. Hypoglycemia is very serious. And some of the symptoms, in addition to like dizziness and blackout and fatigue, some of the symptoms can also include nausea, muscle cramping, sweating, stomach cramping. Okay, always ask clients who have diabetes to check their blood sugar levels prior to the massage. You just have to do it one time. Just say, okay, I'm happy you're coming in. Thanks for making your appointment. Make sure that your insulin is available to you that day. Make sure you don't skip any meals. I recommend that you have a high protein snack before you come in, and also check your blood sugar levels that day to make sure that they're within the limits that you expect them to be, or they're within your normal limits. Insulin dependent clients should always have a source of sugar or glucose available. You can have sugar around for them. So something like fruit juice or regular soda, which has sugar in it, are fine. And for the MBLEx, that's the fine answer. In reality, yeah, it's fine to have like a box of juice or soda around, but that's only going to get them so far. That'll like get them, that'll get their blood sugar back up out of the hypoglycemic range. But then they're just going to crash like immediately after that, because ingesting high sugar items like fruit juice or soda or even bread or pasta, those things have so much available glucose that or convert so quickly to glucose that we just experience a blood sugar spike and then a blood sugar dip, hypoglycemia again. So if you want to give them some fruit juice or something like that, or some soda, that's fine. But please also give them something like some nuts or some other stable protein source. Like I used to bring in like almond butter or Kind bars or a Cliff bar, something like that, something that actually has more protein than just a candy bar or a soda. Not that Cliff bars are that much better than candy bars with the amount of sugar, but they have much more protein and more fiber. So if you can get somebody a higher protein snack right away, even like an apple, piece of fruit, has more fiber and a little bit, tiny bit more protein than a soda, that'll carry them a little bit farther than just a soda or fruit juice or candy. And then if there's drowsiness or confusion, or if someone is difficult to rouse, if someone is non-responsive after the massage, they can't wake up and they don't respond when you tap them and call their name and ask them if they can hear you, then that's a medical emergency. You definitely need to call 911 for that. If your client is drowsy, raise your hand if you've ever been drowsy and not needed an ambulance. So if they ask you that on the MBLEx related to a person who has diabetes and who maybe experienced hypoglycemia, the answer is yes, call 911. But in reality, no. If they're confused, yeah, definitely call 911, because if they cannot get to their car or cannot get home, maybe they don't remember where they are or even where they parked their car or how to get home, then they definitely need help. I would say clinically, I would probably call, if someone's experiencing confusion, I would probably call their spouse or family member before I call an ambulance. It's pretty serious to call an ambulance in terms of the resources mobilized by our first responders, and also in terms of the potential cost to the client. Clients who take a combination of diabetes medications plus other drugs, like non-steroidal anti-inflammatory drugs, such as Aleve, which is Proxen, naproxen, or Advil, which is ibuprofen, or aspirin, or ACE inhibitors, which are taken for cardiovascular symptoms, secondary serotonin secondary reuptake inhibitors, SSRIs, which I believe are sometimes taken for depression. Ginseng, sometimes people take ginseng because it helps them with their health, in some way. Generally, they think. I mean, I know what ginseng does from having looked a little bit at the Chinese herbal materia medica. Don't mean to write off ginseng or marginalize it. It's just that a lot of us, we take herbs like Chinese herbs, not really knowing the full scope of what they do, but because we think that they're good for us. But point is, if they're taking diabetes medications and they're taking other herbs or drugs, even if they're over the counter, they often are at higher risk of hypoglycemia. So you keep that in mind, right? Becomes more important. And if somebody arrives at your office and they're like, I haven't eaten all day and I'm getting my insulin after this, just be like, we got to reschedule. It's not as, I'm not trying to make you mad, and realize that if they're already a little hypoglycemic, they're going to be grumpier than usual. But don't be afraid to do what you think is safest for them and for you. Parkinson's disease. Drugs used to treat Parkinson's disease include parasympatholytics and dopaminergics. Okay, so let's do a little word breakdown. When you want to learn more about medical terminology, it's called word breakdown. So word breakdown. Let's just put in the whole thing and see what comes up. So para, like parasympathetic nervous system. Sympatho, like sympathetic or parasympathetic nervous system, and then lytic. So lytic means like cutting or slicing or stopping, right? So a parasympathetic nervous system is the part of the nervous system or the tone of the nervous system which lends itself to drowsiness, lends itself to rest and digest. When someone is in parasympathetic dominant tone, they're ready to eat, they're ready to digest, they're ready to sleep. They experience sleep pressure or drowsiness. They experience hunger, peristalsis, churning, sounds, gurgling in the digestive system. When someone is in predominantly sympathetic tone, that's fight, flight, freeze, fawn. So that's perceiving a threat and ready to deal with that threat, to preserve their safety, preserve their life, get away from the threat, put down the threat, eliminate the threat, whatever, right? And threats can be the knowledge that you're going hypoglycemic, that you're having an insulin shock or a sugar crash. That can be a threat. A perceived threat can be, well, I guess we don't need to go into all of those. But anyway, so someone who's taking a Parkinson's drug is taking a drug which increases the parasympathetic tone. I'm sorry, reduces the parasympathetic tone. So reduces the parasympathetic tone of the nervous system. Let's see. And effects of parasympatholytics. We don't need to go into this too much. So if parasympathetic, so one of the effects is tachycardia. So that's faster heart rate. If parasympathetic is safety and digestion and rest, then that would imply a slower heart rate, bradycardia, right? So if you block the parasympathetic response, it can lead to elevated heart rate, tachycardia, anticholinergic psychosis. I'm just going to call that panic or anxiety. Let's see what else. Can actually result in sedation, which I would think that it would be activation more than sedation, because if you're stopping the parasympathetic tone, if you're stopping the rest and digest tone, I would think that someone would not be sedated, but the opposite. But you have to be aware that people who take parasympatholytics, excuse me, apparently I'm taking parasympatholytics and I'm not aware of it. You have to be aware that people who take parasympatholytics as well as dopaminergics, drugs which increase the production of dopamine, may be more drowsy and more dizzy than other clients. Common names are levodopa, ledopa, dopar, and you really need to watch for dizziness. This is what you need to know for the MBLEx, is that patients who are taking drugs for the treatment of Parkinson's disease are more susceptible to dizziness. That means caution getting on and off the table, more susceptible to drowsiness. So they may be more drowsy after a session. Caution getting on and off the table, caution going home. Disorientation, nervousness, low blood pressure when changing position, that's orthostatic hypotension. Also, Parkinson's helps muscles to relax. So no, I'm sorry. Parkinson's results in higher muscle tone, right? Muscle tension. So to help muscles relax, you can try effleurage and rocking strokes and maybe some petrissage. But if they are too relaxed, if they're sedated from the parasympatholytics or the dopaminergics that they take, try more stimulating strokes at the end of the massage, like fast effleurage or tapotement. If your client feels dizzy, drowsy, or disoriented, always spot them, offer to help them getting up from the table. You have to know your limits and your client's limits. So, maybe just insist you're going to help them get on and off the table. You can just, hold the drape up or wrap the drape around their shoulders so they still have their arms and their legs free. Some places even give their clients clothing. If you're like me, you can do Toinan Shiatsu with the clothing on. You don't need oil all the time. But I digress. Okay, cardiovascular disease. So cardio and vascular, right? Word breakdown. Cardio means heart. So this is diseases and conditions which affect the heart directly. So that's myocardial infarction, which is a heart attack, angina, also racing heartbeat, tachycardia, heaviness, heavy feeling in the heart, palpitations, and then vasculature. The vasculature are both the veins and the arteries, and those include things like arteriosclerosis, atherosclerosis, thrombosis, which are buildup of clots that can break off and travel, which is called an embolism, right? So and that can lead to like a stroke. So coronary artery disease, heart failure, vascular disease, these are all very broad categories, right? Heart valve disease, other diseases of the heart, all very, very broad categories. You don't need to know like the very specific nitty-gritty conditions. You just need to know broadly what you're dealing with. Diseases of the heart, diseases of the vasculature. In the US, unfortunately, this is the leading cause of death in both men and women. That's, again, something that we as therapists need to think about. We need to be in working condition. We need to be treatment room fit, let's say. So that's something that we definitely have to think about, as well as something that we have to think about for our clients. When clients come in, one of the first things that you should think is, along with the person's age, might this person be at higher risk for having cardiovascular disease? And then what kind of medications they may be on. People are not always going to tell you that they have a cardiac history or any other history. They're also not always going to tell you, not going to volunteer that they're on medications. So these are anticoagulants or blood thinners. Non-steroidal anti-inflammatory drugs are sometimes taken. Aspirin is sometimes taken, and corticosteroids are sometimes taken for cardiovascular disease. So let's go into like the questions portion now. All right. Before we do that, I'm going to get a drink and I'm going to ask you guys about the cautions around these 4 categories. I'll be right back. All right. Thank you for your patience. So anticoagulants or blood thinners. What are some of the things that we need to watch out, the cautions around anticoagulants? What are those patients more vulnerable to that we need to be aware of when doing massage?
Bruising.
Bruising, yeah. And also, what other one starts with the letter B? The blood is thin and doesn't clot well.
Oh no, it's thinning.
Huh?
The blood thins.
Yes, the blood thins. So in addition to bruising, it's also bleeding. And then non-steroidal anti-inflammatory drugs. What do we have to watch out for with NSAIDs? Also bruising, but with NSAIDs, there's often an analgesic or a pain-killing effect. So along with aspirin, NSAIDs, patients who are taking NSAIDs, they may have less pain sensitivity.
So you just got to be careful with pressure you're applying.
Yes, exactly. You have to be careful with pressure. with NSAIDs and with aspirin because of reduced sensitivity. You have to be careful with pressure with anticoagulants because of bruising and bleeding. And then corticosteroids. What do we have to watch for? What do we have to watch for with corticosteroids? Come in here, dog. Come in here. Come in here. What do we have to watch for with steroids or corticosteroids? We have to make sure that the room is clean and everything is sanitized because
Their immune system is weakened.
yes, their immune system is weakened. Also, in the lower legs, they can have what?
Swelling.
Swelling, and their skin is what? Thinner or thicker? Thinner, yeah. And I think someone who's taking corticosteroids also, you should just use less pressure in general, because if someone is prone to having inflammation, they're more prone to soreness or other kinds of adverse effects from the inflammation we create. You guys are aware that massage creates an amount of inflammation, a healthy amount of inflammation, right?
No.
No? Okay. So inflammation can come from an increase in blood flow, which happens after massage. It happens like if you press on a tissue, like trigger point compression, any kind of compression, even petrissage. If you press on a tissue, that occludes the blood, stops the blood flow. And then when you release, a larger amount of blood than normal comes in. So that's a sort of inflammation, temporary inflammation, but also certain hand techniques will inflame the area, like cross fiber friction. You know, you're breaking down structures, you're breaking down scar tissue, even breaking down some aspects of fascia or muscle tissue, and that definitely will cause inflammation. Okay, so let's move on to some questions. So I'm going to get rid of the film strip and then increase the size. I hope all you guys can see this okay. All right, so fill in the blank. When massaging a client who has osteoporosis, the massage therapist must exercise caution during which setting? The use of techniques that cause therapeutic inflammation, the use of compressive forces, scalp massage, or relaxation techniques. So before you answer, I want you to look at the question and I want you to think, okay, when massage a client with osteoporosis, what do clients who have osteoporosis, porous bones with holes in them, weak bones, what are they susceptible to? What's the risk? It's fracture.
Fracture, yeah.
So which one of these, A, B, C, D, do you have caution with? The use of therapeutic techniques that cause inflammation, the use of compressive forces, scalp massage, or relaxation. Which one?
B.
It's B, yes, because compressive forces can do what, Rosie?
It can cause a fracture or broken bone.
Yes, exactly. Okay, a client is on Ritalin. Ritalin is what kind of drug? Is it a central nervous system stimulant, or is it a parasympatholytic? Ritalin is a central nervous system stimulant. Central nervous system stimulant. It's taken for things like, well, I guess I should not give you that part. Client is on Ritalin, which is an amphetamine. Amphetamines, cocaine, those are narcotics. She is most likely, wait, is that a narcotic? Okay, I'm sorry, forget I said that. Amphetamines stimulate the central nervous system. She is most likely being treated for what? A nervous system disorder, respiratory system disorder, cardiovascular system disorder, or reproductive system disorder?
Nervous system disorder.
Nervous system disorder, that's right. Can you name one that people might be taking amphetamines for?
Depression.
Maybe depression, but more commonly for the condition where it's challenging to pay attention and you're easily distracted.
ADHD.
ADHD, attention deficit hyperactivity disorder. Yes.
ADHD.
Yeah. Of the following options, which one does not require a physician referral? Does not require a physician referral. Warm, hard, tender veins, a pulse over 90 beats per minute, a pulse below 60 beats per minute, or a respiration rate of 15 breaths per minute? Which one does not require?
Respiration rate of 15 breaths a minute.
Yes. And can I hear from someone else? Is this question asking which one of these is normal, or is it asking which one of these is abnormal?
Which one is abnormal?
Does not require. Which one is normal? Yes, yes. So which one does not require a physician referral? Is a physician referral required for abnormalities or for things that are normal?
Abnormal.
Yes.
Yeah.
Sorry, I didn't quite hear you. What's that? Okay, so warm, tender, hard veins can be a sign of some kind of venous inflammation, like thrombosis or some kind of infection process. Definitely something that you want at least the client to be aware of and have spoken with their doctor about. Respiration rate of 15 breaths per minute is within normal limits. A pulse over 90 or a pulse below 60 is not within normal range, not within normal limits. Which one is a contraindication? Is a contraindication a condition in which there is no benefit or harmful indication, no benefit and no harmful indication? Or is it a condition for which massage would be beneficial, a general relaxation massage for pleasure, or a condition for which an approach could be harmful?
The first one.
It's
Not the first one, I'm sorry.
condition for which massage would be beneficial.
Would be harmful, would be harmful. So contra, what does contra mean? Does it mean
Okay.
for or against?
The opposite.
The
Against.
opposite,
Like,
against, yes, contra. And when something is indicated, when something is indicated, what does it mean?
that it's okay for massage. That it would
Yes.
be beneficial.
Yes, if massage is indicated, it means massage is good for this condition. And if it's good for the condition, if massage is indicated, it means there's not going to be any harm done, or there'll be a lot less harm.
Okay.
Right? So a contraindicated condition, a contraindication is not a condition in which there is no benefit and also no harmful indication. There should be benefit. And there may be some harm. Harmful indication, this phrasing, these two words is unclear, but they mean harm may be a result is what they mean. Contraindication is not a condition for which there would be benefit. That's not clear. Contraindication is not general relaxation massage for pleasure. Contraindication is a condition for which an approach could be harmful. You could do harm where there's a contraindication. Which of the following drugs impacts the central nervous system and acts as a depressant? Oh, guys, by the way, recommendation for study technique. You know, all these files are available to you in the MBLEx folder, right? When you miss something, when you get something wrong, write it down, right? You just have to write down contraindication. Just write down the date at the top of your study guide, top of your paper, whatever, and write down contraindication and then go to the question on contraindications. Make sure that you practice this a couple times till you understand or till it's really clear. There's some things you have to just practice until you memorize them, but the best is to actually understand things. Okay, which of the following drugs impacts the central nervous system and acts as a depressant? Is it cocaine, nicotine, amphetamines, or narcotics?
Narcotic.
That is correct, because cocaine and amphetamines, those are both stimulants. Nicotine, I forget. Nicotine is just bad news. Stay away from it. Nicotine is also a stimulant. A regular client comes in for their monthly massage. When they arrive, they say, I'm so excited for this. I have the flu and I've had a fever for days. I'm so glad I finally get to have a massage and relax. I know this is going to help. How should the therapist proceed? Proceed with the massage as usual, using only long gliding strokes. Proceed with the massage, but use only deep pressure, or reschedule the session.
Reschedule the session.
Yeah, because fever is a general or systemic contraindication. Also, they're contagious. In a very busy clinic, a new client arrives 15 minutes late to his appointment. Rushed, the therapist begins the session quickly without spending much time talking with the client about his health history. After the session, the client calls to tell the therapist he has a rash along his back. Which of the following is the most important step that the therapist should have done differently? Ask the client if he has had massage before. Ask the client about any allergies prior to treatment. Turn the client away for arriving late. Ask the client about his feelings towards massage.
B.
Yes, asked about allergies. Very good. Okay, it's almost time. I started like 5 minutes late. So I'm going to go 5 minutes. I hope you guys can hang out with me. If you have to leave, I understand. The massage therapist notices an open sore on a client's right thigh. When she asks about it, the client says it was caused by a recent bicycle accident in which they sustained no other injuries. There are no signs of infection. What is the most appropriate action for the massage therapist to take? Avoid treating the thigh, continue as normal. Massage is contraindicated, send the patient home. Avoid treating the thigh and the lower extremities, so both legs. Send the patient home and call their doctor to alert him or her of the condition.
Avoid treating the thigh.
A.
Continuous
Yeah.
normal.
A.
Yes,
Mhm.
yes. Did anyone select C, avoid treating the thigh and entire lower extremities? Great, good. Yeah. A client informs you that he is taking omeprazole, which is Prilosec. What do you take Prilosec for?
Mm-mm.
It's
Heart-
for the heart, right?
Heartburn.
Gastrointestinal.
Yes, gastrointestinal. Yes. The answer is B.
Yeah.
Okay. Which position should be avoided for clients using decongestants? The supine position, prone position, or the side lying?
Supine.
Supine means
Yeah.
face up.
Wait, I mean, okay, prone.
The prone.
Prone, that's right. And
Yeah.
why?
Because they cause the fluid to drain.
That's
the
right.
Sinuses and
Yes, and because the fluid not only can drain out of the nose, it also can accumulate in the sinus holes, sinus passages, so they can be stuffier. During an intake assessment, you learn that a client has a prescription for vasodilators. Given only this information, which of the following conditions are they most likely to have? Hypotension, hypertension, asthma, or anxiety? Okay, so go ahead.
I was gonna say asthma.
Okay, so asthma would be a bronchodilator.
Okay, that's right.
Yes, broncho, like the bronchi in the lungs. Vaso refers to what structure in the body?
Mm.
The blood vessels. And when you dilate something,
They
what
probably hypertension.
probably hypertension, yes. So vaso is blood vessels, and when you dilate something, do you open it or close it?
Dilate,
You open it.
Open it.
open.
You open, yeah. So if you dilate or open the blood vessels, are you treating blood pressure that's too high or blood pressure that's too low?
Too high.
Yes, that's right. Hypertension.
Yeah, too high.
Yep.
Okay.
Good. Everybody likes to answer when they get it right. Fill in the blank. A massage therapist sees a client who is taking analgesics. During this session, the therapist should what? Proceed with the massage as usual, since analgesics will have no effect on treatment. Emphasize inflammatory techniques and increase the pressure of techniques. Use more aggressive techniques since pain perception is reduced. Avoid inflammatory techniques and reduce the pressure of techniques. Which one?
Avoid inflammatory techniques and reduce the pressure techniques.
Yes. Did everybody get that one?
Yes.
Great. If you didn't get it, definitely go back and review and practice. Fill in the blank. Blank are not classified as respiratory medications. So which one is not a respiratory medication? Is it antitussives, which means anti-cough? Bronchodilators, which opens the bronchi in the lungs? Antihistamines, which reduces the histamine response?
Diuretic.
Or diuretics? The answer is
Diuretic.
diuretics. That's right, which increase urination.
Yeah.
Fill in the blank. Necrotic medications are used to what? I'm sorry, narcotic, not necrotic. Narcotic medications are used to what? Prevent.
Relieve,
Really,
relieve pain.
Okay, relieve pain. Good, good. Yes, okay, good. All right. After an injury, the inflammatory response is activated. Which of the following is not a sign of the inflammatory response?
Oh, that's a good question.
Okay, heat,
bleeding,
heat,
Which one does not happen with inflammation?
bleeding,
Bleeding. That's right.
Mhm.
That's right. Right.
bleed. Okay.
For inflammation, you can remember the acronym SHARP: swelling, heat, altered movement, and pain. Swelling, heat, altered use, and pain. SHARP. Altered and redness. Swelling, heat, altered use, redness, and pain.
Mm.
Fill in the blank. Ibuprofen is not a over-the-counter medication, NSAID, analgesic, or expectorant.
Analgesic.
No, incorrect. Ibuprofen.
Yes.
D.
Ibuprofen.
D.
It's D, expectorant.
expect,
Oh, okay,
Ibuprofen is both an NSAID and an analgesic, classified as an NSAID
okay,
that is also analgesic. Okay.
okay. So
Okay. One more.
expectorant is what helps you cough stuff up, right?
That's right. That's right.
Okay.
When you, yes, exactly. A therapist's client is on blood clotting medication. As a result, the therapist should what? Perform massage as usual, always perform deep tissue massage for this client, provide deep pressure and aggressive techniques, or avoid methods that may cause bruising, including compression, friction, percussion, and skin rolling. And the answer is D. That's correct.
D.
D, yes. Okay, we're out of time. Let's see, how many slides do we have left? You guys can go over on your own, and we can certainly do those together next time. So there are still about, see, from 56 down to 64. There's still about 5 or 6 questions left that you can go over and practice. We'll do those next time. I'll try to do those next time. I'll just put like a red background on there so that you guys know where to go. Okay, thanks a lot for your patience today. Looking forward to seeing you guys tomorrow. As usual, if you have any questions or suggestions, you just send me text messages. Okay. Oh, by the way, I don't have answers to questions about like how the test is administered, the randomization of questions, how long between test taking you're allowed if you fail, things like that. Those are more like logistical and administrative questions. I don't have answers to that kind of stuff.
Okay.
All right. Have a great day, guys. See you soon.
Alright.
You too.
Thank
Hope your day
All
gets
right,
better.
bye-bye.
Thank you very much. Take care. Bye-bye.